Hello, a good day to everyone. My name is C.B. Mamaril, and on behalf of the Systems for Action National Coordinating Center, it is my pleasure to welcome you to today's Research in Progress webinar on the cross-jurisdictional sharing arrangements between tribes and counties for emergency readiness. Before we get started, I would like to first acknowledge the funding and support of the Robert Wood Johnson Foundation. And I'd also like to remind everyone that if you have any questions for our presenters or commentators or participants, you can type them in the lower left-hand corner of your screen at the chat box. So just to get everyone in the flow of today's webinar, I will first introduce our presenter, and she'll give her presentation, followed by I'll give the introduction. I'll introduce our commentators, who will then give their comments, and at the end of the webinar, we'll open the webinar to questions and a discussion from the audience as well. So without any further ado, I'd like to introduce our presenter for today, Dr. Maureen Wimsatt, who is Director of the California Tribal Epidemiology Center and Manager of Epidemiology at the California Rural Indian Health Board. Maureen has 15 years of public health research and program evaluation experience with universities in Maryland, Washington, and Michigan, and independent consulting firms. Maureen completed a PhD in human development at the University of Maryland, where she conducted research about health, social relationships, and culture with a laboratory for study of child and family relationships in the Center for Children, Relationships, and Culture. Maureen previously worked for an Indian-owned small business federal contractor in Washington State, where she helped evaluate health and education programs in American Indian and Alaska Native communities. She has also experience teaching master's level courses on community-based research and evaluation. Maureen earned also a Master of Social Work degree with emphasis in rural social work practice and mental health counseling from Eastern Washington University. So with that, I'd like to turn it over to you, Maureen.
Thank you for the wonderful introduction, CB, and good morning or afternoon to all of you on the line. It's a great honor to be here with you today for what is the second Research in Progress webinar for this project. It's a bit more of a final project overview of our study, Cross-Jurisdictional Sharing Between Tribes and Counties for Emergency Management. To review the overview and the goals of the project, it was a research study aimed to explore and promote cross-jurisdictional sharing, or CJS, as I'll call it in the presentation, of emergency management between tribes and counties. And emergency management would be preparedness, mitigation, response, and recovery. The project provided both tribal and county representatives an opportunity to share viewpoints, make recommendations about successful CJS arrangements, guide contents of a toolkit for the project, and in the long term, hopefully contribute content that could help both tribe and county jurisdictions access the funding they need to protect their people before, during, and after emergencies. There is a tribe-county CJS context that highlights the importance of this work. It largely centers around the uniqueness of each American Indian tribe, and that is in a variety of different ways: governance, legal processes, culture, tradition, economic and social resources, relationships with local governments, and also in susceptibility to emergencies. So risk for emergencies and the need for emergency management is important for tribes because many are located in remote and rural areas. You're far from hospitals and county resources, but also given all of those factors in that first bullet point, there's just a varied capacity within all tribes to address different types of emergencies. CJS is one mechanism that some tribes and counties could use. It's collaborative, it's helpful in fiscally limited areas of the country, but also in emergency management. It's a useful tool because emergencies do not have jurisdictional boundaries, and it helps both jurisdictions prepare for population health and wellness through emergency management. Despite the benefits of CJS, an important reminder is that only tribes as sovereign governing bodies can choose to enter into CJS relationships, particularly formal ones, with county jurisdictions. Our overall hypothesis or big takeaway question for this project, we expected there to be differences. Our study was focused on exploring variations in CJS arrangements between tribes and counties. There are 5 research questions I'll talk to you about today. What's the prevalence and scope of tribe-county CJS arrangements? Are jurisdictional measures associated with having arrangements? What about agreement? Do tribes and counties agree about working together or not? What are views and historical and cultural barriers to CJS? A little bit about how data were collected. Tribal and county leaders were approached and asked to select representatives for the study. There were then 2 sets of surveys that we undertook to gather data. Both were IRB approved. The first was adapted from the Center for Sharing Public Health Services and contained items about jurisdictional information and current arrangements. We honored tribal requests for verbal and face-to-face administration of that survey. The follow-up survey was more qualitative and asked about views and barriers to CJS. Our response rate for the project from tribes was 87%, including formal participation from 75%, 83 of 111 tribes in the state. Corresponding county response and participation rate was 100%. All 29 counties associated with those 83 tribes participated. And then our follow-up survey is with a smaller group of 24 tribes and 13 counties. We had response and participation from all of them as well. Here's a map of the initial survey participating areas. The shaded would represent where we have data from both tribes and counties. As a good reminder in California history, there are counties along the California coastline that do not have federally recognized tribes, and that's largely due to the relocation of Indian people and the establishment of missions. So some of those counties on the coast there don't have a tribe that could or would participate in this project. In terms of who participated, I would like to tell you a bit more about the roles of those individuals. So 36 of 83 were elected tribal leaders or staff, 31 were tribal emergency managers, 14 tribal environmental managers, 2 were from tribal health clinics. On the Office of Emergency Services staff, that was our predominant sample for county representatives, with 25 of the 29 being from that office. Tribes reported having a population size between 0 and 84,000 people, while our county said they served 9,500 to 3.2 million people. In geographic size, we spoke with tribes that range from 0 to 547 square miles and counties between 612 and 22,000 square miles. To give you a sense of the counties where we had participation, like what is the context of tribal jurisdictions in that county, we had participating counties that had anywhere from 1 to 18 total tribes in the county. That doesn't mean that all 18 participated in the project, but it gives you a sense of the landscape in those areas. Next, we went through responses encoded into 5 categories for CJS. We looked at whether tribal and county jurisdictions have formal arrangements, informal or customary arrangements, service-related arrangements, shared functions with joint oversight arrangements, or regionalization arrangements. We've retained this original coding because in Indian country there's often a lot of ongoing, sometimes decades-spanning informal or customary arrangements, those handshake agreements, those verbal arrangements, and we wanted to explore that specifically with our group. One note about regionalization arrangements, that would be like 2 jurisdictions merging. That would be a way to think of it, where you have a tribal fire department, a county fire department, and they've become one department that has merged to serve both jurisdictions. Here's what we found. On that first bullet point, 37 of those 83 tribes in 5 counties, they said they had none of those types of arrangements. But there were 46 tribes and 22 counties who said they had something in place, with tribes ranging between 1 to 3 types of arrangements and counties 1 to 4. The graph at the top shows you the most frequently reported types of arrangements. They are informal or customary arrangements for both tribes and counties, followed by shared functions with joint oversight, formal, service-related, and regionalization arrangements. I'm not going to talk about the intercorrelations, but if you rewatch the webinar and are interested in those measures, you can pause on the slide and check them out. So I want to talk to you about some statistical tests we did to compare whether jurisdictional measures were statistically associated with the sum of arrangements or each type of arrangement that tribes and counties were reporting. So we compared the items on the left-hand side, population size, geographic size, total number of tribes in the county, and proportional measures of those three variables, to sum of CJS arrangements and each type of arrangement. Here's what we found. There was a negative association for tribes between number of arrangements and proportion of total tribes to county population size. This is an important finding because it shows that tribes with a higher number of arrangements, a higher sum, were located in counties with fewer tribal jurisdictions to overall county population size. This might be counterintuitive, much like we would think is that there could be strength in numbers. The more jurisdictions you have, maybe the more types of arrangements your tribe has, but in fact this finding shows the opposite. There were also positive associations between tribal population size and formal arrangements, as well as population size and shared functions with joint oversight arrangements, and geographic size and shared functions with joint oversight arrangements. For counties, one significant finding emerged. There was a positive association between informal or customary arrangements and the total number of the tribes in the county. Shifting gears, we explored whether tribes and counties agreed about having no arrangements or working together in some capacity. Of our 46 tribe-county pairs, 46 of our tribe-county pairs, or 55%, they agreed with each other. That means that 13% agreed we don't work together in any way, and 42% agreed yes, we have in some way worked together for CJS for emergency management. However, in 45% of our tribe-county pairs, there was disagreement. In 13% of cases, the tribe reported CJS, but the county did not. In 32, county reported CJS, but the tribe did not. That last finding there gives some numerical backing to what we hear anecdotally in working with tribes, which is that maybe the county says, hey, I have a great relationship with the tribe and include them in lots of our emergency management processes, but we hear from our tribes that sometimes that's not the tribe's perception of the relationship. Here's a pie chart that shows that exact same set of findings. The biggest pie is on the right, 42% agreement about working together. And the next largest pie is the 32% disagreement where the county reported CJS and the tribe does not. There's one last statistical test I'll talk to you about, and that is examining the agreement itself, whether or not the tribe-county pair agrees, and its relation to the sum of arrangements and each type of arrangement. There were findings for tribes only. There was a statistically significant association between tribe-county agreement and tribe-reported sum of arrangements, formal arrangements, informal or customary, and shared functions with joint oversight arrangements. That's a positive association, meaning that the agreement was driven by the tribal report of CJS, by the tribal perception of the work. There were no significant relations between agreement and the county reported arrangements. As a reminder, the next set of questions were qualitative in nature. They were follow-up, and we obtained them from a subset of 24 tribal and 13 county jurisdictions. They included items about views and barriers to CJS. We conducted qualitative analyses to determine emergent themes of these data, responses to the question, and I'll talk to you a little more about those now. For views of the CJS relationship, 4 themes emerged: neutral, negative, positive, and non-existent. I'll read a sample neutral statement so you can hear what that type of comment would sound like. There is an agreement for emergency services on tribal lands called the Gaming Compact, but if there is a level of conversation at the county level about emergency services, the tribe is not at the table or made aware of the meetings. However, tribal council hasn't made a priority to ask the county about the meetings. Negative relationships and views were only reported by tribes. The tribe feels the county is trying to meet a requirement. If there were a natural disaster, the tribe would feel uncomfortable and would be skeptical about whether or not state or county services would be provided to the tribe. Positive views include a great relationship or good working relationship, and non-existent views is where the person would say there is no relationship. Because only tribes reported having a negative view, sometimes the tribal and county views that we coded independently were different. Here's a county and a tribe talking actually about the same emergency event, which has changed their relationship. The relationship is non-existent, says the county. The county as a whole hasn't really heard from the tribe since the flood when the tribe lost property. The tribe about the same event says, the tribe had experienced high waters and nobody from the county came to check on our well-being or alert tribal members. One would be a non-existent relationship. The other is a little more tinged toward a negative perception of that same emergency event. We coded barriers to CJS as they emerged as well. They were legal jurisdictional restrictions, distrust, limited knowledge of tribal systems on the county side, multiple barriers, which means two or more of those first three, other barriers like funding, and no and unknown barriers. So I have quotations for each of these, and we'll flash them briefly for you here, but won't read them for the sake of time. If you go back and replay the webinar and would like to see the quotations and spend time on them, then that will be great. Also, if you want to discuss them in the Q&A section, we'll do that too. So legal jurisdictional related to Public Law 280. Distrust, this quote has to do with massacres of the tribal people on their land historically. Limited knowledge of tribal systems, a lack of understanding in this case about the need for cultural monitors. Multiple barriers, and other barriers, this case funding. To summarize research points, and then I'll go on and talk about project lessons learned and some work products we've developed. This study contributes to the literature because it provides some preliminary understanding about tribe county CJS for emergency management. In California, we have about 20% of the federally recognized tribes in the U.S., and this is a start. This tells us something about this issue nationally. It isn't the other 80%, it isn't 100%, but it gets us talking about this topic and understanding what's going on for our tribes and counties. Due to the participation in the project from tribal government, tribal leaders, and tribal staff, we found that a surprising finding was that not all of this work was taking place as proposed in our grant proposal. We originally thought this would be a project that gets picked up by tribal health programs and health departments. In actuality, although those were people that our representatives maybe talked about as being collaborators, there was deep interest in the government-to-government relationship, and we would encourage future studies to consider involving both governmental representatives as well as health official staff. For our tribes in California, we have some smaller jurisdictions, as you saw from the demographic side. Sometimes less integrated, informal, or customary arrangements were working better and were more frequently reported. That might have to do with just preference, but also we have to remember that in smaller tribes there often lacks a person that can be dedicated to emergency management. And anecdotally speaking, I can share that a lot of what I heard is a tribal staff person wearing many hats, having several roles, and then just preferring an informal or handshake arrangement because of the fact that there's not the staffing in the tribe to carry out and implement and sustain formal arrangements. It's important to engage in cross-jurisdictional communication. Gosh, the findings in this study, at least even in this PowerPoint, talk about 3 areas where the tribe-county perceptions were quite different. We had that 45% of tribe-county pairs that said, we actually disagree about whether we even work together. There were differing views of the CJS relationship, negative versus non-existent views, but also barriers that emerged from qualitative analyses included things like distrust and limited county knowledge of tribal systems. You could see where then ongoing communication and cross-jurisdictional education could maybe eliminate some of those differences or at least reduce them to where CJS and CJS work together is a more viable option because both jurisdictions are on the same page. Now for some overall project lessons learned. It's important to consider emergencies within a societal public health context. All of us on the line might think, wow, that's really obvious, but a lot of the literature and even some of our staff who have been representatives from tribes on this project and from counties are first responders, and the literature surrounding this comes from law and comes from other areas of public health administration. I think it's important for all of us as public health researchers to remember that there is no impact of an emergency without a society to experience it and be impacted. And it is a duty of all of us to consider emergency management in that social lens. I'll share again, reach out to government and health-oriented officials for an understanding of this topic in our different areas of the country, not only with the project findings that I shared a few slides back, but we did conduct a national policy matrix where we interviewed people from each of the Indian Health Service areas. And one big takeaway from that process was that sometimes people that were from the health-only type of departments knew that CJS and government-to-government relationships were underway for emergency management, but they didn't know details of them or have copies of plans. It would be very important to involve all those partners in additional studies or work in this area. I do receive comments at times asking how it was possible that we had such a large participation rate in the state of California with our tribes and counties. I will give credit to the fact that emergency management is a topic that people are deeply invested in, but I would also encourage researchers, especially those who are new to working with tribal populations, to employ a tribally responsive approach to studying tribe-county CJS. So for example, we used a project advisory group to guide a lot of content and modifications we made. They were representatives from tribes and counties in emergency management and also in leadership roles. We did what I would call theoretically guided but responsive research. We adapted our first instrument from the Center for Sharing Public Health Services. So CJS as a topic is often rooted in things like collaboration theory. It has to do with working together to address and promote public health. So in our case, we worked with our advisory group to say, are the questions all relevant to our tribes, but also what about the methodology? It may create messy data, but if we need to go out and honor tribal council requests to gather survey data in person, to read through questions, that was an approach that I feel was the most successful in gathering information from our tribal jurisdictions, especially the ones far away from Sacramento, with limited access to internet and sometimes even phone connectivity. We use Tribal Epidemiology Center staff to gather data and stories. There are 11 tribal epidemiology centers nationwide, including one urban-related Urban Indian Health Institute in Seattle. The staff at those centers are situated to be liaisons to tribes and are trained in protocols and working with tribal councils. It is a method that I think that non-tribal researchers might use working with the techs to gather data and stories in their work along the way too. Consider using mixed methodology, quotations and numbers. Gosh, sometimes I know that's so obvious, but it's tough to get funding for qualitative research at times or to carry it out, and it's labor intensive. But some of our most powerful information, especially in our communities that focus more on oral tradition, came from the conversations we had where the person could just share whatever they wanted in response to the question. Lastly, we circle back to participants at the end of the project. We paid for a meal. We shared back project findings. We honored their participation at regional roundtable meetings and had them sit at the table with their county or tribal counterpart and begin discussions to start or enhance their CJS relationship. There are future directions for research and intervention. For research, I think we need to begin to think about this issue nationally. There's work in Michigan and Wisconsin that has examined CJS with tribes and their county jurisdictions and maybe even other parts of the country where I'm less familiar with that work. But let's take a wider look and cast a wider net and understand what's more happening for our Alaska Native villages and for other parts of the country. In interventions, I think the takeaway from this is that it would be time to think about funding positions and programs that focus on, first, building capacity in tribes, especially our smaller tribes, and also in promoting the ongoing relationship building, that cross-jurisdictional education, cross-jurisdictional sharing at its best as a precursor to formal arrangements. If tribes and counties aren't at the place of developing a formal arrangement, let's begin by giving funds and giving projects and staff roles to support that process. This might involve funding technical assistance experts in emergency management within tribes or tribal organizations. Here are some additional meetings and products I'll briefly review for you. We've had our advisory group, a research in progress webinar from the past. Here's a link to it. We have made several national conference presentations. Most recently, I am back from the National Indian Health Board Tribal Public Health Summit. So there was a presentation on research findings, and then we did a roundtable session, myself and with Dr. Steve Corbett, who I believe is even on the webinar, on your webinar list there, from the Center for Sharing Public Health Services. We've presented at the American Public Health Association and the RWJF sponsored meetings that go along with our grant. Throughout the project, we've developed a national policy matrix, health policy brief, and CJS toolkit. We've conducted regional roundtables in Northern, Central, and Southern California, and have engaged in reporting and manuscript drafting along the way too. If you would like me to talk more about any of these meetings or products, or talk about the content of them as best as we can in the webinar, please type that in the chat box and I'll circle back and address your comment during the Q&A session. Some final photos to share with you. A thank you to our advisory group and some of our data collection staff that have helped with early survey assistance, data collection, and the development of the toolkit. Here's the screenshot of what the toolkit looks like. If you're looking for it online and want to know if you're at the right place, that's what it would look like. Again, please put in the comment box if you would like to talk more about that document. And finally, some photos from our regional roundtable meetings in Sacramento, one sponsored by the Agua Caliente Band of Cahuilla down in Riverside County, our Southern California contact, and one sponsored by the Bear River Band of the Bonerville Rancheria, which is up in Humboldt County on our Northwest California coast. Thank you to the Robert Wood Johnson Foundation, the National Coordinating Center. I can speak from personal experience and say that this project is something that our tribes and counties are passionate about. It's been exciting to contribute to science throughout the 2-year award, and I look forward to hearing from the commentators and all of you in the question and answer session. Thank you. Here's a link to our project page there, and then I'll turn it back over to you. Thank you.
Thank you, Maureen, and just wanted to introduce first our commentators, but before we get to that, I would like to remind everyone if you have questions for Maureen or even to our commentators later, please do type in your questions in the chat box in the lower left-hand corner of your screen. So I'll be introducing first our two commentators, and then they'll give their comments one after the other. So I'll start off with Michael Mudgett, who is an enrolled member of the Spirit Lake Nation in North Dakota and an epidemiologist for the California Tribal Epidemiology Center, housed within the California Rural Indian Health Board. So Michael obtained a Master of Public Health and Bachelor of Arts degree in Psychology from the University of North Dakota, and he has previously worked with the National Resource Center on Native American Aging and the Urban Indian Health Institute. Our next commentator after that would be Anna Marie Jones, who is the Chief Resiliency Officer for Interpro, and she's a member of the National Advisory Committee for the National Health Security Preparedness Index. So for 16 years, Anna Marie was the Executive Director of CARD, Collaborating Agencies Responding to Disasters, where she was responsible for helping nonprofits, faith agencies, service providers, and their distinct constituencies to embrace emergency preparedness, disaster response, and community continuity in culturally appropriate, sustainable ways. So CARD served as an intermediary agency to help build effective relationships with traditional emergency management entities and the diverse communities they serve. So inducted into the International Women in Emergency Management and Homeland Security Hall of Fame in 2012 for her innovations, Anna Marie is currently pursuing a master's degree in marketing, and she's also writing her first book about readiness and resilience in America. So I'd like to first turn it over to you, Michael, for your comments.
Okay, thank you for that introduction. I appreciate it, and thanks to Dr. Wimsatt for that overview of the project. Like she had mentioned, I worked on it throughout the course of the project when I first got to the Tribal Epidemiology Center. And I wanted to just briefly talk about some commentary on the value of the research for policy making by both tribes and local communities, being either counties, city jurisdictions, and whatnot, because throughout our project we've had tribes that work with all jurisdictions and not just counties. But most importantly, I wanted to provide some commentary on some of the things that Maureen had mentioned that I felt would be valuable to reiterate, talking about how our work can be kind of like a guide of sorts. And I think it could be a guide to, we heard Maureen talk about, we represent 20% of the tribes in the nation, but it could be a work to guide what goes forward in the future in other parts of the country, in Indian country, in that understanding and that guiding the work as well that gets pushed forward, to help tribe-county cross-jurisdictional sharing, particularly for emergency management. So when I talk about value of the project, I'm speaking about the uniqueness that our particular project has in terms of what we're looking at with the scope of the project. What are the values? What are the barriers? What are the agreements? Those are things that inform us what works and what doesn't work in tribe-county cross-jurisdictional sharing. And the first point I wanted to bring up is that of informal agreements. I wanted to reiterate how important that is to talk about informal, like verbal handshake agreements with tribes and counties in California as being kind of one of the more important CJS arrangements. At least for me, I see that as something that's a starting place where you can build upon for future, maybe formal arrangements. I know when we talk about the CJS spectrum, sometimes we talk about informal arrangements being on one end of the spectrum and regionalization where, there's mergers being on the other end. And it's important to look at that spectrum as one's not more important, but they're different in terms of what they can do and what one can provide for each other. So it's important to understand tribally, what they can provide, and oftentimes the verbal or handshake agreements are really important. We found that throughout the project, that just how important that is sometimes. And so just to reinforce that notion, especially when we talk about viewing tribes as sovereign nations, we have to approach them as such. They are sovereign entities that we have to view as such. So when you're working with a county jurisdiction to a tribal nation, it's important to understand, you're talking with tribal leaders. And so although emergencies have no jurisdictional boundaries, it's still good to keep that in mind. And we found throughout the project that, of course, that's really important. Tribes want to be seen as sovereign, which is why, our original scope was looking at health programs or clinics, but really it starts at the top down from tribal leadership. They make the decisions or they delegate. So it's important to get that understanding as well. So working directly with tribal leaders may be best to promote or even establish cross-jurisdictional sharing, whether formal or informal, but that also depends on tribal capacity. Like noted before, some tribes have more capacity to work with more formal arrangements or provide more, whereas informal arrangements work best for others. Also, the next point I want to make briefly is just the importance of understanding one of the biggest barriers we see, not just in emergency management, but in Indian country and other areas, public health, research, and other areas. It's just limited knowledge of tribal systems. It's a recurring theme that I've seen come up over and over again, and I think this sheds light on that as well for people who are looking to make policies both in tribes and local communities like counties when working with cross-jurisdictional sharing. So it's important to keep that in mind, and I will turn it over to you guys again for that. Thank you.
Thank you, Michael. And I'd like to turn it over to you, Anna-Marie.
Thank you very much. Thank you all for your comments so far. I'm very excited to be part of this. I would say that my commentary comes from the framework that since 1989 I've been focused on making emergency preparedness, disaster response, and community continuity accessible and culturally appropriate and effective for diverse and often marginalized groups. So for me, I approach this from that grassroots practitioner frameworks, and that's why I want to share some of the things I found to be most important and certainly the benefits, because over the years we found that we needed to actually understand the conversation very differently for different groups, including things like just reframing the language we use so that it was more culturally acceptable and rewriting tools. So part of what I see as the importance is clarity. This level of research, as presented by Maureen brilliantly today, gives us clarity and a framework. I would tell you that emergency management, particularly certain aspects of it, are fuzzy at best, and our grasp on it in society is tenuous and changes with whatever the upset and stressor du jour is. So one, having this level of clarity about things like the relationships, that can change absolutely everything. One of the best slides and one of the best conversations for me was just that proof, that documentation that people had such radically different awareness levels of the relationship. Some believing the relationship was good, some saying it's non-existent. That actually matters tremendously in terms of moving forward and how everything gets framed, as well as understanding the strength of the relationship, who recognizes the relationship, who did you actually get involved with, because honestly, I can tell horror stories of lots of work that was done with different groups where everyone thought they were working with the right people, and then when the initiative is presented, no, actually that person didn't speak on behalf of that group. And things like that really matter if we're trying to build something that will last. Also, in emergency management in general, but in particular how it goes down into communities such as tribes, turnover is an incredible barrier to moving forward. Turnover in traditional emergency management and turnover in people who are holding the leadership roles. So when I look deeper at this, I see a few things, and that's actually part of why on the National Advisory Committee I wanted to be part of things like this, because this will change everything in terms of funding. Funding for research is difficult, but funding for innovation in preparedness, response, recovery, and continuity is sometimes non-existent. And unless we have a stronger platform, unless we can make the sale to all of the entities, we're not going to be able to even go after the money, much less encourage those piles of money to be made available. I see the other benefit being opportunities. If you were to go through this information and the presentation literally slide by slide, you'd be able to see different opportunities that we could pull forth to actually build funding platforms, resource allocation, and partnership. One of the truths of emergency management is that it's very hard to get most people to care about any individual piece of this. And for my money, I would love to see us put more intention around the health initiatives, because the truth of the matter is one of the weakest links in our chain of emergency management and response is in how we deal with health emergencies. And in the bizarre world where I would get to control resources and dollars, I would be putting much more toward health-related initiatives, because you can get people to care about earthquakes, floods, fires, and things like that when they happen, but health is something that more people wish to embrace, and they want for health for their families, their communities. And in truth, there is so much more to be had in a framework that is positive. It is about health. It is about wellness. and it is a different conversation to be had. And if you're looking at tribes over the years, we found that just framing the conversational language around emergency preparedness, response, recovery, around a more uplifting, positive, forward-thinking topic made it possible for people to embrace it. So I find this research to be incredibly important because it, one, provides a level of framework that generally we don't have, and two, it allows us to really hone in on issues that other people are never going to take the time to put into print and point to. If I were involved with trying to find funding for any of the preparedness initiatives, I would be looking to this research to actually just support all of those things that anecdotally are known, but who's going to actually do this? The research like this has some legs. It has some ability to stick because most people are not able to do this level of research. So this is something that can be brought to the fore when we're looking at those funding opportunities and resource opportunities. So that's just a quick overview of why I think this is incredibly important, and it has so many benefits for both traditional emergency management and the tribes involved. So with that, I will stop because really I could be a freak about this topic, but I'll turn it back over to you.
Thank you so much, Anna Marie. I appreciate your comments, and also thank you, Michael. So before we open the webinar to questions from the audience, I'd like to give Maureen a chance to respond to the comments and maybe add on to also her discussion. So Maureen, just give you the next few minutes so you can respond to these comments.
Sure. Thanks, CB. This is the unscripted part of my presentation. So I will just say thank you so much to Anna Marie and Michael. I personally appreciate your words about the research, but I know that our tribes and counties in California, and particularly our advisory group who have contributed such greatly throughout this project, would be excited to hear those words, and on the ground they are excited to participate in moving forward and progress and discussing emergency management in the aims of protecting everybody's people. That's the end goal there. So I don't know that I have too much more to add on to that, but I will say thank you for your remarks.
All right. Thank you, Maureen. So we're now going to open this part of the webinar to questions from the audience, and you can always type in your questions in the lower left-hand corner of the screen at the chat box. And if you think of something later on, these webinars, along with past webinars, are also available for download from the Systems for Action website. So since we don't see any questions right now, I think I would like to use the sort of what remains of the time, Maureen, for you to probably discuss more about the toolkit that you were presenting, and I think that would be probably one of the most valuable products that comes out of this research. And I guess just to start asking you, if you could point out some of the details or highlights of this toolkit. Does it also contain sort of like the data collection protocols or guidance on how to collect data, let's say, as it relates to this type of research from tribal communities? So if you could maybe, take the time to just sort of talk about or discuss more about this CJS toolkit that has come out of your research. That would be excellent.
Absolutely. I would be happy to. So regarding the toolkit, I'll tell you a little bit of context for it. So it was one of our project deliverables, and if anyone has ever worked on a toolkit for any grant, you know that toolkits can be kind of an insurmountable task because you want to have content that matters to different levels of people, different audiences, but also meets your need of your population and your group you're working with. So the subject matter that's in the toolkit actually came at the end of our first survey, and we'd say, do you have anything else to share? When you participate in a survey, that's always the end. Is there any other questions, comments, or concerns, right? And so we went through and drew a lot of the recommendations from the toolkit, not only from our advisory group, but from things that came up in that last question of the survey. And people would say things like, gosh, I really wish I knew how to get started writing an email to my county emergency manager. I don't even know the language to use to say hello and begin a cross-jurisdictional relationship. I would like a communication guide on that. Other people said, can you share a little bit about the emergencies that the tribes talk about elsewhere in California so we can get a sense of what those are? Are they natural emergencies, non-natural emergencies, things of that nature? We had some tribes that say, I wish I had learned along the way how to do individual preparedness and how do you make medication records and phone trees. Do you have templates that we can share? And so we began down the road in that manner. Now, we would be the first to tell you that because we're researchers, we tend to err on the side of let's only talk about our research approach. For this, we really tried to use a framework of being researchers in the sense that we learned a lot. We looked up emergency management, we consulted resources, we did case study conversations with tribes and counties to give other tribes and counties a sense of what emergency management might look like. So the focus of the toolkit is less on our approach, as some of our research documents would include, but it's more on this might be a guide for you to get going in this work, to give to a staff at a tribal or county entity that is new in working with the other jurisdiction, for example. Within tribes, sometimes we have the tribal chairman who is also the emergency manager. And he says, you know, I'm the accidental emergency manager. It's so important to us, but no one else wants the job. And this might be a document where you could become familiar with terminology without having to sift through the internet for it. So there's different content in the toolkit, and I'll just go through the list, a few of them that's available at that link that's in the slideshow. But there's pull-out pages on different educational trainings through FEMA. There's actually several pages of tribe county recommendations for CJS work, and they are presented in their almost raw form in different categories because we felt it was so important for tribes and counties to hear from other tribes and counties about what works for them. We did case studies to show you what does emergency preparedness look like in a tribe? What about mitigation, response, and recovery? And how do those things relate to CJS with the county? What does that look like? What's a verbal example of that so that it's easier to understand those abstract concepts? We also have provided an overview of cultural resources, some information about laws and policies, really briefly about that could influence your work in doing CJS for emergency management, things like, the Stafford Act. How did that change tribes' ability to make declarations and receive reimbursement during disasters? What does that look like? And then we do have some sample templates and plans based on our advisory group input for emergency operations, cooperative agreements, MOUs, EMAC, and then natural disaster recovery framework. So those are templates, but we've tried to tailor them to show you if you want to talk about cultural resources, this might be where you put it in your plan. And they're meant to be a guiding framework and a starting place for tribes and counties in beginning to have conversation and understand where tribal jurisdictions might want to add cultural content or tribal sovereignty content to their plans themselves. So lastly, there's even a coordination of tabletop exercises, and let me tell you all on the phone, this is an area where we're less familiar with that. We did a lot of backstory, and I think we've got a good framework for how you would coordinate a tabletop exercise. We wanted to give our readers a sense of what they wanted to see, but we would be the first to tell you that these are great resources, a great guiding framework, and we'll be excited to hear from all of you about how you adapt them and use them in your tribes and counties nationwide.
Thank you so much, Maureen. I think that's very valuable to be able to talk about and promote this toolkit. And I guess aside from the download link that is provided with this webinar, were there also other opportunities for you to disseminate? And I guess, or there have been cases where this toolkit has already been used in other areas or by other organizations?
Yeah, so I can speak.
Disseminating it, yeah.
Yeah, so we have disseminated out at least electronically to resources. I do have a few hard copies left. Our funding, at least for this specific award, was to be able to focus and sent out to all our tribal and county jurisdictions in California. So we did do that in a hard copy form. It's actually like a binder format, so if you were to attend trainings in emergency management, you could add your paperwork or your own notes behind the section of the toolkit that was most relevant to your training to build into the document itself for your own use. And I am looking at potentially even through other funding streams with CTEC, different carryover funds, it may be possible to do additional paper publication and dissemination, but for right now I would say the best way to gain access to the document immediately would be on that web link or our project page through the National Coordinating Center.
Excellent, excellent. We think it's an excellent product, and so I think it's just great to have these opportunities to promote it and disseminate this product. So thank you for sharing that, Maureen, and also thank you so much for the excellent and wonderful presentation about your research. And we'd also like to thank also again our commentators, Michael Mudgett and Anna Marie Jones as well for the comments that you've provided. And we'd like to remind everyone again that if you'd like to have a copy of this webinar, that it is available for download from the Systems for Action website. And we'd also like to invite everyone who on the audience today to also take a look at our upcoming webinars as well. So we're ending a little early. We give back a few minutes of your time today, and we'd like to thank again Dr. Maureen Wimsatt for her presentation, and to Michael Mudgett and Anna Marie Jones for their comments. And we hope to see you again soon in our future research and webinar series. Thank you, and everyone, please have a good day, and take care. Goodbye.